Did you know that advanced gum disease is associated with an increased risk of heart disease? Well, our next guest, Jen, does, but she doesn't know what to do about it. So she reached out to our show. Let's take a look.
Hi, my name's Jen. I'm a cardiac nurse. This is my dog, Jasper. I just finished a 12-hour shift. As you can see, I'm still in my scrubs, but I'm still smiling because I'm pretty passionate about the work that I do. I've had gum disease for 10 years, and it's something that I'm really paranoid about because I lost my dad from a heart issue. So I'd really love to have more knowledge and advice on how to prevent mine from progressing into something severe.
And Jen joins us today via Zoom. Thank you so much for being here, Jen. And since even healthcare workers like yourself need assistance sometimes, we're also joined by CREST expert Deborah Carrier. And she's going to help answer your question about how to improve your oral health. But first, I wanted to say, Jen, that I'm so sorry to hear that you lost your dad. Do you have a history of heart disease in your family?
Thank you, Dr. Wharton. Yes, my father died from heart disease when he was only 60, and my paternal grandfather also passed away from heart issues.
Well, then you are right to be concerned about your oral health because, as you know, problems in our mouth can also affect the rest of our body. So, Deborah, what are your thoughts on this topic?
Dr. Wharton, you're right. And although improving oral health is important for everybody, it's especially important for people like Jen, who are already concerned about heart disease. Jen, you mentioned that you've had gum disease for about the last 10 years. And if your oral care routine isn't up to par, then gingivitis, which is the early stages of gum disease, can result in advanced gum disease. And people with advanced gum disease have an increased risk of heart disease.
And that's because bacteria are constantly attacking our mouth and causing distractions to our body's protective systems. These type of attacks can lead to gum inflammation, which typically presents as gum redness or bleeding when brushing and flossing. Jen, do you ever have any of these symptoms?
Yes, I do have bleeding when I floss. In fact, my dentist warned me of the health consequences of this and recommended I floss 3 times a day. I make an effort, but to be honest, I only floss once a day. However, I do get extra cleanings and a water floss. This has helped, but to be honest, I want to do more because I'd like to grow old as healthy as I can. What do you suggest?
Well, Jen, here's some quick and easy tips to promote good oral health. We all learned when we were young that you should brush your teeth, but make sure you do it at least 2 times every day. I know it sounds simple, but not everyone does it. You ever fall asleep without brushing your teeth? You shouldn't do that. And remember, flossing your teeth is as important as brushing them. Floss and use a mouth rinse in order to remove food that can lodge in between teeth. Cavities can form there as well. Also, get to know your mouth. Look inside it regularly to check for irritated gums or any other changes that you should alert your dentist about. The sooner you address an issue, the more likely you are to have a better resolution. But unfortunately, sometimes gum disease does not show any signs until you have serious damage. So make sure you see your dentist at least twice a year for thorough cleaning and a professional checkup. Deborah, any other tips for Jen?
Yes, in addition to everything that you just mentioned, finding the right product is just as important. I would like to recommend that Jen try Crest Gum Detoxify toothpaste. Its foaming formula helps neutralize harmful plaque bacteria even below the gum line. This helps to reduce inflammation and reverse the early stages of gum disease. Bacterial issues start at the gum line, and this toothpaste starts working there to improve overall oral health. And Jen, you can find all these great oral care products at Walgreens and walgreens.com.
Thank you so much, Deborah. I love learning new things. I'm going to check it all out.
Deborah, thanks for coming back and joining us today.
Thank you for having me.
And Jen, thanks for your question and for your service as a healthcare professional. We appreciate you. Take care.
Thanks so much for having me as well.
Stay tuned. You'll be right back to the doctors.